Well, it is a common question for parents. How much screen time is too much? Well, it's one of the many questions eye doctors with Henry Ford Health say they're fielding right now as children prepare to go back to school. Our doctor, Frank McGeorge, talked to a pediatric ophthalmologist about what parents should know when it comes to back to school eye care.
Hey, thanks. I'm joined by Dr. Sharmila Segar. She's a pediatric ophthalmologist at Henry Ford Health. Dr. Segar, thank you so much for joining me this morning.
Happy to be here. Thank you so much for having me.
So, pediatric ophthalmology, there's a lot of interesting breakthroughs, but let's just start with the basics. When should kids start getting routine eye exams?
Great question. So basically, children will get eye exams from birth, and then they'll have their first screening eye exam between ages 3 and 5, pre-K, and then they'll continue to have eye exams that are screening exams at school. So that'll happen. That's something to expect during the school year. So that'll happen at grades 1, 3, 5, 7, and 9. At that point, they check whether the vision is equal between the two eyes, whether there are any eye misalignments. So that's the first check. And if there are any issues there, then they're referred to an eye physician. After that, they might even get checked out earlier on if they have a family history of vision loss, if they have any genetic eye conditions, if there are any eye traumas, red eyes, also something to notice for your children, or if you ever take any pictures of them and you see a white glow in the center of their pupil, that's also a need for an eye exam. So basically, routine eye exams are a good idea just to check out the eyes, but they're also safe by getting their state mandated screenings.
So, what are some of the most common issues that are identified that lead someone to have to follow up with an optometrist or an ophthalmologist?
Yeah, so the biggest issues are if one eye is seeing stronger than the other eye. That is something called amblyopia. So the visual development system is in progress from birth to ages 8 to 12. That's kind of under debate when the visual system stops developing the connections between the eyes and the brain. So basically, we can see if those imbalances exist between the two eyes and then try to make the weaker eye see stronger. Different methods to help with that include patching. That's our number one thing. And also we can use glasses. We can use sometimes an eye drop to help strengthen the weaker eye as well. So that's a really big issue. And then eye misalignment problems is a really common thing that we see as well, which could require treatment like I mentioned, or also surgical procedures might be necessary for those as well. So those are the two big ones, but we have a wide range of eye issues that can affect children.
Now, nearsightedness is also a reasonably common issue. When might a child need glasses other than, let's say, with amblyopia or a lazy eye? Name some other situations where the nearsightedness becomes bad enough that they need glasses.
So typically, when a child is below 5 years old, their world is up close. So they don't really have any issues being nearsighted because they're needing to see at near anyway. So the times at which we usually prescribe glasses for nearsightedness or myopia, basically when the vision is blurred for distances, is once we hit age 5 or so. And at that point, then they need to see boards in school. But of course, we're having more screens at school with virtual content up close. So that kind of changes things too. But regardless, usually it's around age 5 that we usually recommend glasses for nearsightedness. Unless it's quite strong, then we might recommend it earlier on. Other eye issues like astigmatism is also something that we prescribe glasses for. And that's when the eye is not shaped like a perfect ball, it's shaped more like a football where one side is steeper than the other side.
So relative to our behaviors and really kind of screen time, increased computer use, that kind of thing, increased use of near vision, is that harming our children's eyesight in any way?
It's a great question. It's something that is a huge topic right now. And basically, something that we know over time is that less time that we spend outside and more time that we spend indoors is associated with having an increased risk of nearsightedness. Having a lot of near focused work basically can promote the eye to become more nearsighted as well. So with screens, there are a few things that we can recommend to try to decrease those risks. So, one of the things is when we are up close looking at screens, we do want to take frequent breaks. That helps relax the eye muscles that have to focus in to do that near work. So, I recommend that every 20 minutes, a child or even adults look away for 20 seconds at something 20 feet away. So that kind of just helps relax those eye muscles, helps the eyes just lubricate a little bit, just make sure that the eyes are kind of relaxed, closed. Um, Basically, we don't blink as much as well when we're looking at things up close. And that can help potentially reduce some of those risks with the nearsightedness. The American Academy of Pediatrics used to have kind of guidelines of how much screen time we should have per age, but they've kind of revised those recommendations to understand that we have screens everywhere now. They're in schools. It's one of the ways that is used to educate our kids now. So basically, they have different ideas of what we can do in terms of using the screens to basically promote educational activities, using the screens with family members, and kind of figuring out a plan that works well for your family and the age groups that are your kids are in the family. So maybe having zones in the home where we don't use screens or having certain times of the day. But there's you can actually go online to their website and see whether you can make a personalized plan for your family.
All right. And real quick, one last question. As far as cutting edge treatments for common eye problems, what are some questions that you're hearing from parents?
Hmm. So I think that very commonly this relates back to the nearsightedness thing is what kind of treatments can we do in terms of laser procedures or contact lenses to help prevent the nearsightedness from getting worse. And often with laser procedures, those are things that we have to do until the eye kind of stabilizes and growth over time, usually past age 18. In terms of contact lenses, there is an FDA approved contact lens to help decrease the risk of nearsightedness, decrease the progression over time.
And it actually
And
shapes the cornea.
there are two actually. There's orthokeratology, which actually shapes the cornea overnight, and that's something that can have the risk of infection though, because we're having nighttime contact lens wear. And then with the other approach, it's called a positive defocus lens, basically a contact lens that is worn throughout the day, daily use, and it focuses the light a little bit farther away from the back of the eye, the retina,
Mhm.
and that is thought to help decrease the risk of the nearsightedness getting stronger over time. So that's something that once kids are at an age where they are able to handle contact lenses, not sleep in them ever, then that's something that they can use.
Excellent. Well, that's really great. Is there anything we didn't talk about that you want to bring up here?
I would just say during sports season, just make sure that we use eye protection. It's not always the coolest thing, but it's something I definitely recommend that our kids protect their eyes, especially during contact sports and sports that have any sort of balls or anything that could be thrown at the eyes.
Super important. Well, Dr. Segar, again, thank you so much for joining us this morning. I really appreciate it. Have a good day.
Absolutely. Thank you so much.